So here I will tell you about the renin angiotensin system. So it is a system basically concerned with the control of a blood volume as well as the blood pressure. Now before going to the detail about renin angiotensin system, just have a revision of the functions of a juxtaglomerular apparatus. Now we are clear about the structure of this JGA, that is a juxtaglomerular apparatus. So just we will briefly look the functions. Now you know there are three important types of the cell in the juxtaglomerular apparatus. One are the juxtaglomerular cells, then other are the macula densa cell, and third one there is a Lasik cell. Okay. So now here the juxtaglomerular cells of this apparatus that are basically concerned with the secretion of the enzyme renin, and this renin it activates the renin angiotensin system, and which is primarily involved in the regulation of the blood volume and the blood pressure. Second cell, there is a macula densa cell that acts as a sensor that detects the changes in the rate of a flow and volume of a flow in the tubules, and also the composition of renal tubular fluid, and form the physiological basis of the tubulo-glomerular feedback. So this macula densa cell basically it acts as a sensor, and they are also providing feedback to the juxtaglomerular cell. And then third one, that is a Lasik cell, or also called as an extraglomerular mesangial cell. They are basically concerned with secretion of a renin and erythropoietin to a certain extent. So now here is a brief description of the renin angiotensin system, and then one by one step we will discuss detail. So first is the kidney that is involved in this renin angiotensin system. So the kidney it is concerned with the secretion of a renin from the juxtaglomerular cell. Now that renin it will act upon the angiotensinogen, that is a glycoprotein secreted by the liver cells. Okay. And then that angiotensinogen it will be converted to angiotensin 1 by this renin, and this angiotensin 1 it will be converted to the angiotensin 2, okay, by this enzyme that is known as angiotensin converting enzyme that are mainly secreted by the endothelial cells of the blood vessels in the lungs. So this is a brief description of this renin angiotensin system. So first look at the renin. So it is basically a type of the enzyme that is the acid protease and secreted by the juxtaglomerular cells of the kidney, and it acts as enzyme to convert angiotensinogen, that is a glycoprotein secreted by the liver, to the angiotensin 1. This is the primary function of the renin. So this renin activates the renin angiotensin system, which is essential for the regulation of the extracellular fluid volume, blood volume as well as the blood pressure. So the first step in the renin angiotensin system, it is the secretion of the renin and conversion of the angiotensinogen to angiotensin 1 by the renin. Now the regulation of renin, that means when it will be increased or decreased. So the factors that will increase the renin secretion, that includes the decreased blood volume and the blood pressure, decreased plasma sodium concentration, that is a hyponatremia, or increased potassium concentration, that is a hyperkalemia, and certain catecholamines when they will increase the renin secretion and also the prostaglandins. So hypovolemia, hypotension, hyponatremia, hyperkalemia, all that they will increase the renin secretion. While the factors that are concerned with the decrease in the renin secretion, that includes increased plasma sodium concentration. The primary factor is hypernatremia. Then the increased blood pressure, that is hypertension, will also lead to decreased renin secretion. Then the hormone like ADH, antidiuretic hormone, and also the angiotensin 2 itself, they will decrease the renin secretion. Okay. So the most important here it is the plasma sodium concentration. It is the most important electrolyte concerned with the renin secretion. Whenever the sodium concentration will decrease, it will stimulate the renin secretion, while whenever there is a increased plasma sodium concentration, it will decrease the renin secretion. Then coming to the angiotensinogen, that is a glycoprotein synthesized in the liver, and when it is secreted it is in a physiologically inactive form. So it is basically acting as a precursor for the formation of the angiotensin 1. So as I have told, angiotensinogen, that is the inactive precursor for the angiotensin 1. So it will be acted upon by the renin to be converted into the angiotensin 1. And there is another important enzyme that is a part of this angiotensin, rather renin angiotensin system, that is a angiotensin converting enzyme, or a ACE. So it acts on angiotensin 1 to convert it into the angiotensin 2. So this angiotensin 1 will be converted to angiotensin 2 by this enzyme. And this enzyme is synthesized and secreted by the endothelial cells of the blood vessels throughout the body, but mainly or in a more concentration it is formed in the blood vessels of the lungs. So lungs, it is the primary part where the maximum angiotensin converting enzyme will be synthesized and secreted. Then angiotensin 2. So angiotensin converting enzyme act upon the angiotensin 1 to convert it into the angiotensin 2. Now it is the most important angiotensins. There are multiple angiotensin, angiotensin 1, angiotensin 2, 3, 4. But out of that, angiotensin 2, it is the most potent and most important. And it is having a multiple action that will help to restore the blood pressure and the blood volume. So the action of this angiotensin 2 can be divided into the two parts, the peripheral actions and the central actions. Okay. So the peripheral actions of the angiotensin 2 are, one is, it is the most potent vasoconstrictor. It will constrict the blood vessels, most of the blood vessel. So it is even more potent than the norepinephrine. Okay. So by this vasoconstriction, it will increase the blood pressure. Then second, it increases the synthesis and the secretion of the aldosterone from the adrenal cortex. Another most important action of the angiotensin 2. So adrenal cortex, it is a gland present over the kidney from where the aldosterone will be secreted, and by this angiotensin 2. Then angiotensin 2 also causes the contraction of a mesangial cells that will decrease the glomerular filtration. Okay. And another action is it will increase the sodium and water reabsorption from the proximal convoluted tubules. So these are the multiple actions of the angiotensin 2 by which it will help to prevent the water and the electrolyte loss, and it will help to restore the blood pressure and the blood volume. Okay. Then certain central action of the angiotensin 2 are, it acts on the brain centers to decrease the sensitivity of baroreflex. So it will decrease the baroreceptor reflex. Then the most important action here is it stimulates the thirst center in the brain to increase the water intake. So it will stimulate the thirst, so that person will drink a lot of the water. Then it also increases the secretion of the ADH, antidiuretic hormone, or a vasopressin from the posterior pituitary. And it increases the secretion of the SCTH from the anterior pituitary. And finally, it also acts as a neurotransmitter in certain areas of the brain. So these are the important central as well as the peripheral actions of the angiotensin 2. Now this figure narrates the whole renin angiotensin aldosterone system. So renin angiotensin system, it can be also called as a renin angiotensin aldosterone system, because here the aldosterone is also a part of this system. So now just look at here, you know, the angiotensinogen that is secreted by the liver. So that is a physiologically inactive form, and that will be acted upon by the renin. Renin that is secreted by the juxtaglomerular cells of the kidney. Okay. And this will be converted to the angiotensin 1. Angiotensinogen will be converted to angiotensin 1 in presence of the renin. Then this angiotensin 1 will be acted upon by the angiotensin converting enzyme that is secreted mainly by the blood vessels of the lungs, and it will be converted to the angiotensin 2. And then angiotensin 2 can be converted to angiotensin 3, and then angiotensin 3 to angiotensin 4. But this angiotensin 2, it is the most important here, which is having a multiple action. So you can see here angiotensin 2, it is a most potent systemic vasoconstrictor. So it will cause the vasoconstriction by which it can elevate the blood pressure. Second action is angiotensin will increase the secretion of the aldosterone from the adrenal cortex gland. Okay. And that aldosterone, it is having a very important action over the various part of the nephron, where it will increase the sodium and water reabsorption. So it will increase the reabsorption. That means it will prevent the water and electrolyte loss from the kidney. And then another action of angiotensin is it is directly over the kidney. In the proximal converter tubules, angiotensin will increase the water and electrolyte, mainly the sodium reabsorption. Okay, so by increasing sodium and water reabsorption, it will prevent its loss. Okay, then another action of angiotensin 2 is over the brain. That means central action, where it will increase the thirst center. So it will stimulate the thirst center, by which it will increase the water intake. Okay, thought center that are present in the hypothalamus, that will be stimulated by this angiotensin 2. So person will drink more water. And second important is angiotensin 2 will also increase the ADH secretion from the posterior pituitary gland. So more water intake and increase ADH. And ADH action is over the kidney to increase the sodium and water reabsorption. Okay, mainly the water reabsorption. So antidiuretic hormone, it will increase that water reabsorption from the kidney and prevent the water loss. That means they are inhibiting the diuresis. By all these action, there will be increased sodium and water reabsorption from the kidney and decrease its loss. So by which it will restore the blood pressure and blood volume. Now finally, here is what is the importance of renin-angiotensin system when it is required and how it will work or it will help to control the things. Okay, so the most important stimulus for this renin-angiotensin system are these factors. One is the hypovolemia, decrease in the blood volume. It may be due to hemorrhage or any other factors. Then hypotension, decrease in the blood pressure. Then hyponatremia, that means decrease the sodium concentration. With that, there may be also another factor, that is hyperkalemia. So these all the factors will cause the release of the renin from the juxtaglomerular cells. And this renin that is secreted by the juxtaglomerular cells of the kidney, it will convert the angiotensinogen that is secreted by the liver to the angiotensin 1. The angiotensin 1 that will be converted to the angiotensin 2 by this enzyme ACE, that is angiotensin converting enzyme, that is secreted by the pulmonary blood vessels. And this angiotensin 2 again can be converted by the various enzymes like peptidase to angiotensin 3, and then angiotensin 3 to angiotensin 4. But this angiotensin 4, it is inactive metabolite. It is in inactive form. Okay. So the most important here is angiotensin 2 and also to certain extent angiotensin 3. Okay. So this angiotensin 2, as I told earlier, it is a potent vasoconstrictor. It will also secrete the aldosterone from the adrenal cortex. Then it will increase the thirst. So it is having a dipsogenesis activity. So and in addition, the most important is that angiotensin 2 will increase the salt and water reabsorption from the kidney. Okay. And similarly, the angiotensin 3, it can be also having a similar effect like angiotensin 2, but it is a less potent. It will also increase the aldosterone secretion and also having a vasoconstrictor effect. So all these factors, but mainly this salt and water reabsorption, they will help to restore the blood volume and the blood pressure. So the blood volume and blood pressure that is decreased here, that will be sensed by these, and activity of this renin-angiotensin aldosterone system will increase or it will normalize the blood pressure and the blood volume. So hope you are clear about this. So in this way, the renin-angiotensin system, it will help to control the extracellular fluid volume, including the blood volume and also the blood pressure. Okay. So there is also clinical importance of this system. So as I've told, whenever there is a decreased blood pressure, this system will elevate the blood pressure. But in certain cases, like a person suffering from hypertension, where the blood pressure is more, in that case, certain drugs that are given that will inhibit this system and they will decrease the blood pressure. Okay. Of which the most important is the drug that are acting over this enzyme. Drugs that will block this enzyme. So that drug group of the drugs are called as a ACE inhibitor or ACE blocker. So that drug will block or inhibit this enzyme, activity of this enzyme. So prevent the formation of angiotensin 2. So the certain drugs like captopril, enalapril, that will help to reduce the blood pressure and that are routinely used in the treatment of the hypertension. Okay. So this all the important aspect regarding the renin-angiotensin system or renin-angiotensin aldosterone system. Thank you.